Closer to home, Illinois lawmakers are proposing a so-called right to die bill. If passed, terminally ill adults with less than 6 months to live would be able to take physician-prescribed medication to end their life. Now, critics of the bill argue this would pose serious societal risks, and disability advocacy groups have said it could disproportionately impact people with disabilities. But if the bill is passed, it would make Illinois the 11th state with a right to die law in the books. And there are many guidelines that would have to be met before a person would even be given the drugs. Earlier, we spoke with the author of the bill, Illinois State Senator Linda Holmes, on why she believes in it and her personal experience with this issue. We're joined by Senator Linda Holmes. Thank you so much for joining us today. I wanted to start with the requirements of this bill. How would this bill work?
Well, obviously, there's quite a few what I call guardrails in place to make sure that there are protections out there. What we're talking about is people who medically have been given a diagnosis of having less than 6 months to live. They have to be mentally capable of making the decision to take a prescription to end their suffering before they pass. So you have to see you see one doctor, then you see another doctor, and both doctors again confirm you have less than 6 months to live. If either doctor has any concerns about it, they have to refer you to a mental health care specialist who determines whether you can make this decision or not. Once that decision is made, and obviously this is adults only, you have to be 18 or older, you then have the ability to request from these doctors, and it has to be done in writing. It also has to be done, in talking to them. And there's a 5-day period in between there that has to pass. So you can't instantly make this decision, get the drug, and be able to administer. And you have to be able to self-administer the drug.
Wow. So there is a lot of, guidelines to this. You talk about this from personal experience, right?
I definitely do. I was 15 when my father was diagnosed with lung cancer. So a 49-year-old, really healthy man, all of a sudden is diagnosed with lung cancer in September, goes through radiation and surgery. By January, I was there the last day when he was in the hospital, just emaciated. I don't think he weighed more than 100 pounds. Still coherent, in a great deal of pain, and he passed. Fast forward to 2016, my mother's diagnosed with pancreatic cancer. Now, mom raised us knowing she did not want any DNR, any extraordinary measures taken. And I think it's obviously because of the experience she had of watching her husband die. So this is something she would have opted for had she been able to. And that's exactly what this allows people to do. They have very few options at this point. They're going to die, which is why I have so many issues when people call this suicide. These people do not want to die. My mother did not want to die. These people want to live. They don't have a choice. They're going to die within 6 months. So let them do it on their own terms without suffering.
Hmm. What have you heard from your colleagues in the legislature about this?
I'm talking to my colleagues. This was the reason I wanted to introduce the bill now in bill form, so that all the parameters are out there so everyone could see what was in it. Otherwise, there's so much misinformation of what people are saying. So it's in bill form so everybody can take a look at it. They can find out what the guardrails are, what needs to be done in order for this to work. And I'm considering this a period of education of members to be able to talk to my colleagues, to be able to hear from our constituents, to be able to answer those questions. I never want to pass a bill that is this impactful and have everybody say, wait, this was rushed through in the dead of the night. We didn't have any opportunity to study it. This bill will not do that. Everybody will have the opportunity to take a look at it.
More than 400 Illinois physicians were surveyed by the advocacy group Compassion and Choices on this topic. By a margin of 58% to 25%, those physicians said they would support physician-assisted death, but nearly 40% of those surveyed preferred to stay neutral and neither support nor oppose a law such as the one Senator Holmes is proposing.